All right. Well, welcome everybody. I haven't taken a look to see who's here, but I trust that I know some of you, if not all of you. But I'm really happy to be here today. If some of you maybe don't know me, my name is Elizabeth Dvergsten-Beauce, and I'm the social worker here with Lung Cancer Canada and with our new Airways of Hope program. I'm joining today from Treaty 1 territory, which are the lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. Today is an exciting day because this is the first webinar in our new educational series that the Airways of Hope program is launching. So stay tuned for more. We're really excited to start this new series. And where this particular topic came from was from patients. It came from anybody who filled out that survey we recently sent out. And we heard that this is a topic that people wanted to talk about and that people wanted to explore. So this is where that came from. So thank you for participating in that. And thank you for being here today. We will, what this next hour will look like is I will present for a little while about this topic, moving forward and living well with a lung cancer diagnosis. And then at the end of the presentation, there will be lots of time for questions and discussions. So feel free to use the chat function if that's open. I'm not sure, but if it is there, feel free to use that. And then we'll, yeah, as I said, have a time to talk and to chat together afterwards. So this webinar, it's interesting. This is a really interesting topic that comes up a lot for people. And, moving forward after a lung cancer diagnosis really means a lot of different things to everybody. Some people have treatment and they move into recovery or remission or surveillance, while other people stay on a maintenance therapy or ongoing treatment. But this webinar really is, there we go. This webinar really is for anyone that has been impacted by a lung cancer diagnosis and has wondered what comes next. Where do we go from here? And I think that this quote is a really good one to kind of summarize that question. While I was having chemo, I quit doing almost everything. So when treatment ended, the challenge for me was, what am I going to do now with my life? What should I go back to doing? And it's really that in-between space where there's a little bit of time to start thinking about what the next steps are. So that's what this webinar is. Again, it's for anybody who's been impacted by a lung cancer diagnosis. As you perhaps have probably experienced, a lung cancer diagnosis can turn a life upside down within a matter of a few words and within a matter of minutes. And that common and expected response that people, talk about feeling and experiencing really is a range of emotions. It is shock and numbness, worry, stress, fear, anxiety, guilt, anger, hopelessness, perhaps. There can also be a sense of hope and clarity about what comes next, perhaps, maybe a sense of determination and perseverance. So again, that range of emotions is far and wide and can all be experienced multiple emotions at the same time. We know that cancer impacts all parts of life, physically, emotionally, practically. That impact is again far and wide, and for patients as well as their circles of support. So when I say circles of support, what I mean by that is it's a patient's family member, a friend, a caregiver, a coworker, a community member. That circle of support can be far and wide as well. But cancer impacts everybody. And going into treatment, there's an awareness that treatment can be challenging, that treatment requires a lot of energy, a lot of resources. It takes all of the focus, understandably, and time, kind of moves one day at a time. But once some time passes, a person moves through that initial phase of diagnosis and then maybe into some treatment. And somewhere along the way, this looks differently for everybody, but somewhere along the way, some space starts to open up. And that question of, well, now what, comes up. And that's again where this webinar comes in. It's starting to pick up the pieces that have come off the shelf and putting them back up on the shelf. Some of those pieces fit, but some of those things don't fit anymore. And oftentimes people say that they don't expect things to change overnight, but there's a hope. There's a hope that there will be a sense of moving forward, or a return to normalcy soon afterward. But really, what I hear people talking about is that it's not so much about getting back to normal as it is about finding what's normal for you now. Things, oftentimes, as they do after a big life event, they look differently than they did before. And people say that there's sometimes a sense of new meaning to life, or that there's a different perspective that they take or have after a cancer diagnosis. And a person can also expect for things to continue to evolve and change as recovery goes on, whatever that moving forward looks like for people. So again, this experience is different for everybody, but there are some commonalities in the experiences and challenges that people face post-treatment. Some of those challenges, it's interesting, some of them are expected. Sometimes they're a continuation of what a person has been experiencing already, whether it be pain or other symptoms that we'll talk about in a bit. But other times, those things that come up are new and unexpected. And that can be really hard to know, what to do with that, how to move forward, given the new and unexpected things that are coming up. But what we do know about cancer and the cancer experience post-diagnosis, so again, whether or not somebody's on treatment or is finished with treatment, but what we know is that all parts of life can still be impacted. Many people experience short-term and or longer-term effects, which are sometimes known as late effects. And late effects can show up, sometimes months or even years after treatment. As people are living with lung cancer longer, we are learning more about those effects and then how we can manage and treat those effects. So as things continue to shift and evolve, we're continuing to learn more about how we can help and support people moving forward. Some of the common challenges that people experience, again, the impact of cancer is far and wide, and those challenges are also far and wide. So physically, pain is a very common experience that people have post-diagnosis and perhaps post-treatment. Fatigue and energy levels, that's a huge thing that people experience as well. Changes in thinking or memory or attention, sometimes it's referred to as cancer brain or brain fog. Digestive or bowel issues, skin effects, neuropathy, breathing issues, poor sleep quality, all of those are very common experiences post lung cancer diagnosis and post treatment as well. Emotionally, again, there's a range of emotions. A person often can feel happy that treatment maybe is over, or that there's more kind of if maintenance therapy or immunotherapy is there, that there's like some predictability and consistency to that. But there can still be a fear of recurrence, lingering around. There can be a lot of feelings of anxiousness for upcoming scans or results from tests. There can be an experience of a renewed sense to life or a connection to life or a sense of purpose, but still frustrated with those lingering symptoms if you're experiencing any of those. Maybe a person experiences depression or anxiety or fear or grief. Grief is also a huge expected or I guess common experience that people talk about, is grieving what was before the cancer diagnosis, that it's no longer as it was before. And oftentimes there can be a confusion about where to go from here. This big life event, lung cancer has happened, but now where? Now, where do we go from here? And there's sometimes a lot of confusion or lack of clarity at that point. Spiritually, again, cancer can impact a person's sense of themselves and the world around them. There can be a questioning of faith or religious beliefs. It can be an existential disruption of sorts. It can really shake a person's foundation in what they believe and know, pre-cancer diagnosis. And that can be really destabilizing and really startling for a person to experience. Again, we talked about the impact of cancer being on the circles of support as well, and there can be, challenges within that as well for social and familial relationships. Sometimes with a cancer diagnosis, oftentimes roles shift. So, and dynamics in relationships shift as well. So perhaps a spouse or a child has taken on a caregiver role. So that shifts dynamics in a relationship. Sometimes friends show up as you might expect them or want them to, and sometimes they don't. That can shift dynamics as well. Work can be impacted. So that relationship with family members or friends or colleagues, that can be really challenging for people to experience. A lot of times I also hear patients talking about how, post-diagnosis, post-treatment, they might look okay. They say that I look good on the outside. I look okay. You wouldn't guess that cancer is in my life. And yet on the inside, I feel so differently. So there can be a sense of loneliness or isolation for a person as well that can be really challenging. And again, this desire to return to a sense of normalcy can be felt really strongly, particularly in relationships. And there can be a lot of confusion or difficulty in knowing where to go from here, I guess. Financially, cancer can really, again, turn things upside down. And that's the same goes for the financial wellness and that area as well. So there can be shifts in financial security or insecurity. Sometimes if finances were a source of stress before cancer, with a cancer diagnosis, it can just be amplified or magnetized even more. There can be maybe a disruption in plans for retirement. And sometimes people maybe feel like they want to go back to work, but they're just not ready or able to yet. So that can be a confusing thing to work through and be really challenging as well. But as always, if there's any symptoms or worries or concerns that you have, definitely speak to your healthcare team. There's never a worry or concern too small or too big. All of it warrants a call, at least to a healthcare provider or a professional of sorts. So certainly reach out if you ever have any questions or concerns. So, people moving forward after a lung cancer diagnosis, there are really specific needs that come into play. And it's really important to identify what those needs are in order to find meaningful solutions and ways to move forward. But how do we do that? How do we find meaningful ways to move forward after a lung cancer diagnosis? That's the question of the day, which is why we're here talking. So we'll dive into each of these categories, but in a nutshell, there's really kind of the way that I've presented it today is like through four different categories or four different points. Number one, how do we move forward? Identify what your needs are. And we'll talk about that in a bit. Develop a wellness plan. Connect with yourself, connect with others around you, and move at your own pace. So again, we'll dive into each of these. So the first one, identifying needs through a self-assessment. This is what I do when I talk to patients or to circles of support. It's always, this question of, for me, why is that person presenting to me right now, and what are their needs? And this is something that people, everybody can do on their own as well. And by identifying our needs through this self-assessment, it's really being able to take a moment to check in with yourself through this particular lens of wellness, and being able to identify what it is that you need, and then being able to personalize your own care plan and finding those really specific, meaningful solutions to move forward. With cancer treatment specifically, so much of the emphasis on physical health, looking at our needs through this holistic perspective looks at the whole picture. It looks at the whole person. And that's what I'm talking about when I say dimensions of wellness. So dimensions of wellness, I like to think about them as gas tanks. Again, cancer often looks at that physical health impact, but we have all of these different gas tanks within us, all of these different dimensions of wellness. We have our physical health, of course. We have mental and emotional health, spiritual health, intellectual, occupational, social, environmental, and financial. So I think of those again as gas tanks. And doing this kind of gas tank check-in every day or even multiple times a day, it's like you're driving your car, you're on a road trip, and you're looking at you're watching your gas meter to see where your levels are at. We can do the same thing with our dimensions of wellness. And these dimensions, they're always dynamic, they're always changing and fluctuating as levels do. And they don't need to be necessarily equally balanced, but they do all require some type of attention and care. So again, that question under your sources of stress section, what's stressing me out right now? What am I worried about? What am I concerned about? Are some of my gas levels lower or higher? Is my physical gas tank lower? Am I getting good sleep or not good sleep? What is my nutrition like? How am I moving my body? Emotionally, how am I feeling emotionally? Am I having a lot of feelings of anxiousness or depression? Or am I carrying a lot of grief or anger or guilt inside of me? That impacts that emotional gas tank. Socially, am I connecting to the people that I want to be connecting with, or do I feel a sense of isolation or loneliness? That would impact that social gas tank. So that's kind of that category of gas tanks that we're talking about. So the second part, number 2, what are my goals or desired outcomes? It's really important to have clarity around the vision that we have for ourselves. It's really important to have that idea of where it is that we are going, or where we think we want to go. Where does this roadmap take us? If we're thinking about moving forward after a cancer diagnosis, if I had that map in front of me, where are the different destinations or points on that map? We can't control the future. We can't always predict what will happen, but it is important to have an understanding or a vision about where it is that you want to go, so you can move forward in meaningful ways. The third point there, taking action points. What are ways that we can take action? We've identified our sources of stress and what our needs are. We have a really clear idea about what it is that of where we want to go, but how can I get there? How can I take action? And one of the ways that I find really helpful to think about this is through the acronym SMART. So you may have heard of this before. I find it really helpful. So SMART stands for specific goals. So get really specific. Manageable. Are the goals that you're setting for yourself, are they actually manageable? Are they achievable or realistic? Are they relevant to where you're at now? And are they time specific? So again, being time specific is all about having it within a time that you can feel like you can achieve that goal. And then the last one is, what are the tools that you have right now? What are your sources of support? So sources of support could be the tools, again, already in your toolbox, the coping strategies maybe that you already have, the people in your life that are already supportive that you could reach out to again. So it's about recognizing what it is that you already have, and then you can identify what it is that you need to move forward. Do you need to speak to some other professionals, healthcare professionals, mental health professionals, financial advisors, nutritionists? Who are the
Doing
people
well
that you?
with Airways of Hope, doing well with
Oh,
cancer.
I think maybe somebody maybe not muted. If you could all make sure your mics are muted, that'd be great. Thank you. So again, recognizing what those sources of support are, and identifying what it is that you have in your toolbox, and then finding ways to add some new tools. So how do we do this? How do we move forward from this point? You've identified your needs. You've identified the vision that you hold for yourself. You know where you want to go. You've identified some ways to get there and maybe some tools you need to get there. So let's create a wellness plan. And a wellness plan is really important because it really considers your own unique needs in this present moment. Again, a wellness plan is a way to recognize your own needs in this moment at this time. And a part of that is, setting realistic expectations for yourself. It's again going back to that idea of finding a new normal. It's not maybe what was, but it's what is right now in this present moment. And specificity is really important. Consider some changes that you want to make. Again, thinking about that vision of where you want to go, get really specific about, what it is that you want. Maybe you want to make some changes to your nutrition or to your exercise or movement throughout each day. Maybe you have a goal that you want to stop smoking, perhaps, or you want to connect more with people. Get really specific about what it is that you want and or that you want to bring into your life. And then lean into those sources of support. Optimize whatever it is that you have around you. Optimize those tools, those coping strategies you have, optimize those relationships, lean into those things internally and externally that are around you. Maybe it's, again, people, activities that you have, hobbies, maybe it's routine. Maybe a part of what you've identified in what you need is to have more of a routine around you, more structure. That can be a helpful way to move forward as well. So there's lots of different ways that this shows up. It's just about getting really specific about that and being clear about that vision for yourself. And identifying areas that need support. And this is really important when we think about who it is that we need to connect with. So when we think again about those gas tanks, where are all your gas tank levels at? Your physical health, your emotional health, spiritual, financial, social. Do a quick assessment of where those levels are at. And then think about, where can I fill up some gas in all of these areas? Where can I connect so I can feel healthier and more well? So maybe it's about connecting with healthcare professionals that can continue to offer care and support moving forward. Those sources of support are there perhaps in your oncologist or your cancer care team. Maybe it's reconnecting with your GP. And also, there's a lot of follow-up care or long-term follow-up clinics that can be really helpful sources of support for people. Oncologists and GPs can and do offer this, but maybe there's also additional sources of support in your community that specialize in long-term follow-up care, particularly for cancer, for people who have had cancer. So, it's just about asking your healthcare team for some information and connecting to those appropriate sources and those relevant sources. Maybe having some additional support for pain and symptom management would be helpful. Lymphedema support, nutritional, dietitian support, PT, OT, counseling. I mean, there's a whole wide range of different supports and services that are out there. But again, it goes back to identifying what your own unique needs are. And also I want to mention in that connection piece, the impact and benefit of connecting to a counselor and or to a peer support group after you've experienced a cancer diagnosis. Those can be really, really meaningful sources of support and can help to offer a sense of validation and acknowledgement in what it is that you're going through. And it can also help to hear about what other people have experienced and how they're finding ways to move forward as well. So I really want to emphasize the importance as well of counseling, emotional support, and peer-to-peer support and group support. And then the next part of that plan is taking time. I often hear people, patients particularly, talking about the whirlwind or the roller coaster that a cancer diagnosis brings to that life or to their life, and how going through that, when a person maybe starts to get to a place where they feel a little bit better, or there is that question of, moving forward, they just want to get there. They want to return to a sense of normalcy. They want to go to something that feels more comfortable, less worrisome, less concerning. And oftentimes what I hear people say is that it takes longer sometimes than they thought it would or that they expected. Taking your time and moving at a pace that feels right for you is, again, all about recognizing where it is that you're at and your own unique needs. Finding what works for you right now in this moment, and then fine-tuning as you go along. Regular self-checks, again, checking into your gas tanks, that can be really helpful, to do on a daily basis and to do with others around you as well. Again, as we talked about lung cancer and a lung cancer diagnosis and the impact of that, it can significantly impact a person's life as well as the people around them. It can feel really overwhelming, and treatment can be challenging. There's this kind of understanding that it will be challenging. And, sometimes people think that that's the most difficult part of it, and that life afterwards will return to normal. What I do hear from people is that sometimes, again, it's not necessarily about returning to what was or that old sense of normal, but rather finding a new normal. Moving forward after lung cancer is finding that new normal and what that looks like. It can bring new and unexpected challenges, and it can be really confusing and hard. There are ways that we can meaningfully move forward. Recovery takes time. And it looks different for everybody. I think that's the really key piece here, is that it takes time and it looks differently for everybody, but there are common experiences that people have and ways that they have found to move forward in meaningful ways. So taking time to check in with yourself through this lens of wellness, recognizing that we are more than just our physical health, we are all of those different parts of ourselves, emotionally, mentally, spiritually, financially, socially, occupationally. That's a huge picture of who we are. So taking time to check into that part of yourself, identifying your own unique needs, what it is that you need to fill up those gas tanks, the tools that you have, and identifying and knowing what it is that you need to add to that toolbox is all about, or those are all ways to personalize your own care plan and develop that care plan. And connecting with yourself and others is, that's that meaningful way and supportive way to move forward after a lung cancer diagnosis and to live well. This quote here I really appreciate. Courage doesn't always roar. Sometimes courage is the quiet voice at the end of the day saying, I'll try again tomorrow. That's really, I think, the essence of what it is to meet yourself in this moment, in this day, knowing that it's one step at a time. So, of course, if you have any questions, if you feel like any of this resonates, or you're curious about any of it, or you would like some additional support, I'm here to offer this support. Lung Cancer Canada is here to offer this support. This is what we're here to do. It's to help you to move forward in a meaningful way, whatever that looks like for you, wherever you're at in this moment. So don't hesitate to reach out.